So let's talk more about cosmetic dentistry. It's a quality of life service that must be offered in a simple and readily understandable manner. It's not life-threatening, and people can live without it. So you're competing with other luxury goods or other quality of life items that people may want to buy. Insurance definitely won't offer it for you, and they won't pay for it. Yet it need not be a barrier. You can get your fee without insurance and at full fee. If you're interested, let me know, and I'll send you more information about the HIPAA Privacy Act and send you a form which patients can sign and which will allow you to proceed without the encumbrance of insurance payments. And it's totally legitimate. But you have to present cosmetics, or the prospect will make another purchase instead. So what do you need to make all this work? Well, you need to have a practiced and repeatable case presentation system. You need someone to work with the doctor on this. Some team member who's interested in presentation and sales, who'll take the time and is allowed the time to work with the doctor in implementing the sales system. Appropriate positioning and promotion is necessary. Sufficient patient flow is a must. If you don't have enough people coming into the office or you're not seeing enough people, you're not going to be able to strike the odds that are necessary to present properly. And then finally, you need high confidence in what you're doing. Now, in today's discussion, we're going to discuss really four things: how to get organized, how to communicate with patients effectively, how to turn your promise into reality, and how to deliver final restorations that exceed expectations every time. So let's get started with offering cosmetic services. I know you want to get to the technical part as soon as possible. I will cover it, but first let's talk about how to get the cases lined up, because without that, you're not going to go anywhere. Who are your prospects? How do you present? Rejection is probably your greatest fear. If you present to disinterested patients, they'll perceive the office as too aggressive. If you're afraid of no, you'll never make a sale. So who are your prospects? First of all, they have to have a physical need for cosmetic dentistry, and that's something that you know. They may want to look better, and they may have the financial resources. You don't really know those two things, but you have to find out. So how do you know who or who is not a prospect? Well, that's separating gold from the sand, and that's an art in itself. So you want to use a repeatable system to find out who is a candidate and who's not. You can qualify prospects starting with the first phone call. For example, you can ask leading questions like, how do you rate your smile on a scale from 1 to 10, with 10 being the most perfect? The patient says, well, 7, 6, 5, something like that. Then you've got someone who's a candidate for cosmetic procedures, and you should proceed along those lines. If they tell you they're already thrilled with the way they look, your chances are less. This is qualification. You should frame the fees for people at an early stage so they understand that these are procedures that may cost thousands of dollars, and ask them if this is something that, in fact, they really want to do. Show examples and testimonials of your work. Of course, that's essential. Display a cosmetic simulation of patients. Gain more insight at a complete oral physical. Schedule a time, if the patient shows a desire, where you can really proceed with confidence. Present a written treatment plan with the right people in the room at a subsequent visit. The right people being the doctor, the team salesperson, the patient, and the patient's financial other. 4 people. And of course, make sure you follow up at the end. So, who will be your leader? That's really important. Think about who in your office can take on the responsibility of helping you present these complex cases. One very important part of the cosmetic presentation is using pictures to do the talking for you. It lets patients sell themselves. The visual case presentation starts with a smile and works back from there. It lets the patient want the results before discussing anything, and it develops trust and confidence. Help your patients understand what it is you're trying to offer them, because patients are blind to the possibilities of having a nicer smile. They don't see it, they don't understand it, they don't know. Unless you can show them how they will appear with a new smile, your chances of case acceptance are very, very much diminished. So use cosmetic simulations to communicate with your prospects. And this same device will also guide fabrication of the case. So there are two prongs: patient communication, a guide to the laboratory on case fabrication. Here are several examples of cosmetic simulations. You may like these, you may not, but these are possible outcomes that could be achieved. These are all hand-drawn. They're clinically accurate. These are results that you can expect to get in your office. Cut and paste doesn't work here. These need to be each one individually drawn. Success depends also on your sales team. Who will be the leader, and how will that person be rewarded for success? After all, this person is selling. I hate to keep using that word, but they're selling, and they're entitled to make extra. That's different than just doing clerical work. So whoever is leading your sales team, keep that person in the loop and reward them properly. Presenting simulations. One way is to show a sample simulation to illustrate to the patient how it could look. Explain why it's the essential first step in planning of a case, because it is that important. Charge a fee or offer it for free. If you charge a fee, some people won't see the need for it and will say no. When, if shown for free, they might say, oh, I see the difference, now I'd like to proceed. So generally, we recommend doing it for free, but if you prefer to charge a fee, go ahead. You'll get less cases, but at least you'll get reimbursed for what you do. Wait for the okay to take your image, but don't discuss technical details until the patient's expressed a desire to go forward. Make sure that you send prints and email of the images to patients at home. Very, very important. We've done cases 17 years later in the lab. It's important to send the pictures, the prints, because people will keep them. Also show them before and afters. When they come back to your office, both you can show them the actual prints, or better yet, show them on a large screen monitor, flashing back and forth, and that's right on your imaging site. All of this working together will give you the maximum results for this really one-on-one advertising. Discuss the simulation at a subsequent visit, and make a written and verbal case presentation to interested prospects. Follow up on the phone or in person. Ask, how do you feel about the images we sent? Are there any questions? Do you have any comments? Do you want to come in and talk with speak with the doctor about this? Send monthly notes to keep in touch. Answer all questions, and certainly review the simulations with patients when they come back at recall visits and subsequent visits. Remember, things change and their attitudes will change, and it never hurts to renew this concept when they're showing up again. When people say they are interested to proceed, that's when you want to set up your consult with the right people in the room, and or a complete oral physical to review the clinical findings. And then finally, there's closing the sale. Meet with the patient and the patient's financial other. Best to have 3 options in writing, offered by the doctor at the consultation, with the doctor, the team member present, the patient, and the patient's financial other. Should not take over 20 minutes to present such a case and come up with an option that's suitable for that patient. When done properly, you'll find that the great majority of these patients will go forward with one of the 3 options. Have the treatment coordinator arrange the finances. If you want to really make this happen and do more cosmetic cases, you will double your income, because these are done fee for service and they're profitable and they're also fun to do. This is a very quick overview I'm giving today, and so I'll be really happy to meet with any of you. Just give me a call. We'll set up a meeting. We'll talk about what you're doing now and what could be done to make this work even better for you in the future.